pelvis, the lowest point, pouch of Douglas, a little bit wider in the male with subtracting the uterus. So in the female, it's from the back wall of the uterus to the back wall of the pelvis, and then for the male, vesicle or urinary bladder to the back wall. That's the lowest point in the pelvis that gets a lot of clinical interest, especially for sampling fluid down in that area. Okay. Then let's transition from the gross dog kidney up here to the histo, right there. You can lean a little to your left. There we go. So now we're going to see cortex versus medulla, pyramids. So when we first look at the cortex, you see these distinctive corpuscles. As soon as you see renal corpuscles, the Malpighians, then you know you're in renal cortex or column. And then you've got tubules all around. My only concern next week is you don't jump too quick to sort of mistake these for islets. It's sort of similar, but you look around, you got tubules, you got the little trenches, Bowman's capsules. So that shouldn't really happen, confusing that with an endocrine tissue, as pancreas. So oftentimes, as I keep mentioning, listen carefully. If I show pancreas, I'll say, what endocrine tissue is this? And if you say renal cortex, okay, I tried to help, but you didn't take it. All right, then we got higher magnification, renal capsule on your right, this line right there, collagen fibers, and then into the cortex. Great look at a renal corpuscle, Bowman's capsule, where it's discontinuous, VP, that's all you gotta say, just VP is fine. Capillary tuft inside, glomerulus, and if you're really good, reinforcing lecture material, EC membrane. The dark nuclei are the endothelial cells of the glomerular capillaries. You see the lighter nuclei, lighter blue? Those are wrapped around those endothelial cells. You know them as podocytes. Right? Give you the visceral layer or the inside layer of Bowman's capsule. It's not really a layer, it's just intertwined cells on the exterior of those capillaries. Here you can actually see a nuclear difference making up the EC membrane. Then you go outside the corpuscle, 3 tubules you'll need to identify out here. The first, you're just looking at this one compared to this one. You say, well, nice and round, big, thick cells, much more elongated, thinner cells. That's all you need to see. PT, DT. And then the third type, completely different with those nuclei just about touching, just right next to each other. Then you have to have a CD, or a collecting tube wheel is fine. Looking around, this compared to this, compared to this. DT, PT, CD. That's all you need to do for those 3 types of tubules. Okay, then corpuscles go away. There are no corpuscles, it's pyramid or medulla. So this is really a mass of collecting ducts. Some vasculature we'll be talking about next Monday. Works along with those tubules, remembering a nephron is a combination. And then even the long loops going way down, another one there. Don't have to know those, but we'll be talking about them a lot. Long loops down amongst the collecting ducts. The only reason you don't make 3 gallons of urine is that little loop coming down into the pyramids. All right. Then all you do here with this type of epithelium, stacks of cells, but they bulge into the lumen, makes it transitional epithelium. And as soon as you make that identification, the wall is thin, even knowing the whole slide, the whole section's on the slide, got to be ureter compared to a little bit on the slide where the transitional is just a little line. You see it over here in the inset. Dome cells, pillow cells. So now you've got urinary bladder vesicle. Ureter, urinary bladder. That's all I want you to do with those other urinary structures. Okay, and then the look of urinary bladder.